When assessing reasons for lower back pain, there are a couple of assessments or movement protocols I like to go through with my patient. First up, I like to look at active straight leg raise, and we compare difference between right and left side. High degrees of laxity or flexibility, as well as very immobile joints or high degrees of laxity, can both be potential reasons for lower back pain. Next up, I like to get my patient into an all fours position, and we'll go through what's called spinal dissociation. Now, this is just a fancy term to see if they can move different segments of their spine individually. First up, we start with the pelvis region. Can we go into a posterior tilt and an anterior tilt comfortably and with control? We move up the spine to the thoracic spine, and we do the same thing there. Can we go into flexion and extension with good control? Now, either end of the spectrum, high degrees of laxity or very stiff or immobile joints are both potential reasons for lower back pain. Back in a supine position, I then put my patient into internal and external hip range of motion. Again, we're looking for close numbers to norms, but very high degrees outside the norm levels are potential reasons for lower back pain. Lastly, I like to go into rotation, and we look at specifically thoracic rotation. So we get the patient to sit right back on their feet to reduce any lumbar movement, and from here I thread the needle and lift up as high as possible with my patient. We compare like we do with everything, left and right sides. From here we can then design a protocol or a program to target the specific reason why someone might be struggling with lower back pain, as opposed to just a generalized approach.